Good afternoon, everyone. My name is Mary O'Dowd. I'm the Executive Director of Health Systems and Population Health Integration for Rutgers Biomedical and Health Sciences. I formerly served as New Jersey's Commissioner of Health, and relevant to the topic today, I was there during Superstorm Sandy and its recovery. And I am a Douglas College graduate, and so very happy to be welcoming all of you to a Rutgers event. I'd like to introduce our panelists, Commissioner Judy Persichilli, the Commissioner now of the New Jersey Department of Health. She is a graduate of the Rutgers University College of Nursing and has been leading our state's response throughout the COVID pandemic. She has a very long history of leadership within New Jersey's hospitals and healthcare systems nationally. Also with us is Linda Flynn. She is the Dean of the School of Nursing and has led our school here through the pandemic as well, working to reimagine nursing education and school operations through these very interesting and challenging times. She has a very strong and impressive history with nursing education, research, and clinical operations. And Carl Kirton, also with us. Carl has been leading the nursing workforce as the Chief Nursing Officer at University Hospital in Newark, which I am a board member of. And Carl has a long history as a vocal advocate, not only from New Jersey's public hospital, but also for nursing in general and culturally competent care here in New Jersey and beyond. I just want to kick off today by saying thank you to the three of you, wonderfully compassionate and thoughtful nursing leaders here in the state of New Jersey. And I want to recognize that tomorrow kicks off National Nurses Week. And so thank you to each of you in your special roles as nursing leaders here, but also to all of the nurses in New Jersey and beyond, and those listening in particular here today. Today's conversation has been titled Nurse Leadership Through Crisis, Examining COVID-19, Health Equity and Care. And when I think about nurses and crisis, I think of some of those very personal moments in my life when my child is up late and not feeling well, and I'm calling that helpline trying to figure out, should I be taking them to the emergency room or can we make it through the night and get to the doctor's office the next morning? And so nurses are very close to my heart, as well as being close in my family. My grandmother was a nurse, and one of my favorite aunts, hopefully she's listening, is a nurse as well. And I really want to thank you from the bottom of my heart and represent so many others that have been so filled with gratitude for the work of nurses over the course of the last 2 years in particular. And just to start the conversation, I'll turn to you, Commissioner, to ask you, how did your education and professional experience in nursing prepare you for crisis leadership during this COVID-19 pandemic?
Well, first of all, Mary, thank you so much for inviting me to be on this panel. The most exciting things that I do lately is talking to nurses, because I think coming out of this pandemic, not only New Jersey, not only the United States, but I think worldwide, the value of nurses was really emphasized by the frontline work that nurses did every single day, putting their own lives in jeopardy to take care of others. So I want to start by thanking you for including me in the panel, telling Carl and Linda it's an honor to be with the two of them, and also for any nurse that's out there that helped in some way during this pandemic. I can only say thank you as the Commissioner of Health, because we needed each and every one of you. So, all my life, I wanted to be a nurse. I don't ever remember, there's two things I don't remember ever not wanting to be a nurse. And at this point in my long storied life, ever not being a nurse. And I like to say repeatedly, I graduated from high school. I wanted to be a nurse. I wanted to go to a diploma school. I wanted to do it quickly, and I wanted to get out and work. And I went to St. Francis Hospital School of Nursing, and I did all of that. And I like to say St. Francis taught me the concept of caring across the continuum. And then I went on, I thought, oh, I think there's more to this. And I went on and got a BSN from Rutgers. And I like to say that Rutgers College of Nursing, when I went, it was College of Nursing, taught me to be curious about the science and the role that nurses play in improving the lives of other people, no matter where you are in nursing, whether you're in community nursing, school nursing. The role of nursing across the continuum is founded in science. It's a foundation of science that brings that science, I like to say, to the bedside, to the community side, shoulder to shoulder with the people that need it the most. So everything I experienced as a nurse, I was an intensive care nurse, and we had some rough times and some rough nights, and I was in an inner city hospital on a weekend. You can imagine what that was like. But everything I learned, actually, I used during this pandemic. You know, you like to think about your past experiences, building on what you've learned over time gets you to a point where at some point you use all of it. And that's exactly what happened. And it was everything I've learned as a nurse that I used. Setting your goals early on, knowing what you want to accomplish, knowing every day what your mission is. You know, what do we want this to look like at the end? The concept of communication, there's no nurse that doesn't communicate clearly to the patients that they serve, to the people that they're serving, to the physicians, to the rest of the team, to the other nurses. So communicating clearly and constantly so you can accomplish your goals is something that we learn when we go to school to become a nurse. The concept of data and science guiding what you do every day is something that you learn as a nurse. The concept of equity and making sure that everybody has equal access to whatever you have to offer as a nurse is something that you learn and you use every day. I don't think you have to talk about the concept of compassion. We go about our work every day, not only with the mission in mind, but with the heart and soul of the people that you're serving in mind, no matter who they are, where they live, no matter their station in life. And I think at the end of the day, I know I learned as an intensive care nurse, not only to pivot between priorities, because you never knew what emergency was going to happen, but to innovate, to make sure that you could take care of your patients in the best way possible. And we had to do that every day during the pandemic. You know, when we didn't have enough PPE, when we didn't have ventilators, nurses at the bedside, and all of us here at the department were using everything that I learned to innovate to make sure that our all New Jerseyans had access to care and were taken care of. And at the end of the day, I can't tell you how many people say to me, why are you still there? Nurses know you never leave until the mission's completed, whether it's the end of a shift or as you become nurse administrators, the end of a year, the end, you know, you set goals and you never leave until that mission's completed. So I have to say, I don't think I could have withstood the last 2 years if it were not for my nursing background.
Thank you so much for sharing that, Commissioner. Carl, do you want to add to that?
Sure. So how do you follow up with those beautiful and eloquent words about nursing? I don't know if there's nothing I could say that would, compare to those, but thank you, Judy, for those beautiful words. When I think about my own professional experience and that prepared me and my team for the crisis that we went through, I think a lot about the HIV and AIDS epidemic. I was a nurse in the 1980s, and when HIV all of a sudden appeared on our doorstep. And just like this pandemic, back then we were dealing with the unknown, the fear, In that day and age, there was no such thing. There was such thing as PPE, but we were still, putting an IV without gloves, and you got blood all over your hands, and people were dealing with this new and emergent disease. But at the end of the day, nurses pivoted and took care of those patients through their acute illness, and so people were dying, just like they did during the COVID epidemic. And nurses were there at the beginning of their life and at the end of their life. And it was a pleasure to see how nurses just stepped up to the plate. One day you were delivering babies and the next day you were taking care of COVID patients. And so nurses always know how to survive a pandemic. And as Judy said, it's always the outcome that is important, making sure you're there for the patient and the family as well. Thank you.
Thank you, Carl. Linda, do you want to add to that?
Yes, absolutely. Thank you, Mary. And let me just say that I'm so honored to be on this panel with the commissioner and with Carl Kirton. Thank you. Thank you for inviting me. I think as practicing nurses, we begin from day one of our practice to deal with crises. As others have said, it's that post-op patient that unexpectedly starts to hemorrhage. It's that patient that presents in the emergency department with chest pain and goes into cardiac arrest. And so we are taught through our education and through our practice to develop critical judgment and critical thinking skills, gathering data, assessing the situation very quickly, gathering input from others, looking at the options of action and picking the option that we think will produce the best outcomes. And that is pretty much the approach I think that we used during the pandemic. In nursing education, our challenge was, how do we adequately educate the next generation of nurses, and at the same time, keep them safe, keep the patients safe, keep our faculty and staff safe. And so it was that critical thinking and critical judgment that we learn in our education and in our practice that I think really came in handy to help me and to help those that I work with find the course of action that hit that sweet spot, that spot where you are maximizing the benefit, but at the same time minimizing the risk. And so that's how I think education and practice has helped.
Well, I have to say that I'm so glad that we had so many very well-trained nurses in charge here in New Jersey when we've been going through this crisis for the last 2 years. I also want to note, this is logistics. If anyone has a question while they're listening, there is a Q&A feature in the chat, not the chat box. You can use that also, but the Q&A feature is how we're going to try to keep track of all the questions that come in, and I will be monitoring that, and we can ask your questions of the panelists as well. But I do have some pre-submitted questions that I'm going to go through. One of the things that I just want to reflect on what you all have said is that, I have worked on a project professionally writing a book in the last few years, and we highlighted some nursing leaders. And I was, as a non-nurse and looking at their work, was so impressed with how they so frequently put the patient first and the full patient. And so frequent when we look at the practice of medicine or other kinds of healthcare policies, you're looking at a disease-oriented approach, and nurses and the nurse leaders that we looked at, whether it was Ruth Williams Brinkley or Marilyn Tavner or Florence Wald, they saw the whole person. And I think, Carl, you said this too, the family. So it was this broader approach to health and care that nurses brought to their leadership that was really inspiring to me as well. So I just wanted to note that, because I've seen you all individually reflect that as well, because I've had the pleasure of working with each of you in different ways. So the next question I wanted to talk through a little bit is the equity issues that we have seen throughout this pandemic. And this has come through in a variety of different mechanisms and in a variety of different ways, whether we were looking at gender or race or workforce dynamics, putting different communities or individuals at risk, throughout the pandemic, and the power of those dynamics in this healthcare space. And so, Commissioner, I'll start with you again and just ask you to sort of reflect upon those issues that you've seen.
Yeah, thanks, Mary. The pandemic has had a disproportionate impact on communities of color. Just a couple of statistics. Young Hispanic men have 3 to 4 times the mortality rate of their white counterparts during the pandemic from COVID during the pandemic. African American men and women have 3 times the mortality rate than their white counterparts. So, the pandemic, disproportionate impact on communities of color didn't start with the pandemic. We know that social determinants are definitely impacting particularly communities of color. And we also know that the pandemic just laid bare and emphasized what was going on. So very early on in the pandemic, we started tracking what was going on with race and ethnicity, and that we do that to this day. And I got reports every single week, first on the mortality by age, by gender, by race, by ethnicity. And we started developing what we call the Vulnerable Persons Committee. And we identified about 32 different groups. And then we put teams of people together just to deal with and relate to those groups. And there were people that were getting impacted disproportionately because of where they worked, like the meat packers, or anyone working or in a congregate living situation. Or if you were an immunocompromised individual and you were on renal dialysis. So we had a group for renal dialysis patients. Or you had a disability that inhibited your ability to isolate or quarantine, or you were in multi-generational housing, which increased your vulnerability to COVID. We looked at people that had essential positions, essential services, not just our frontline healthcare, but anyone that could not stay home when we basically closed lots of services. So about 32 different groups, and that continues to this day through vaccinations, are coordinated through the Department of Health, because we need to make sure that what we saw in the very beginning in terms of the disproportionate impact is handled on the back end by making individuals as safe as possible through our vaccination programs. But we've learned a lot, and we've learned that the most important thing we can do is move as close as we can to the people that are affected. And I could go on and on about how we brought mobile vans, and still do, right into neighborhoods, into churches, into places where people feel safe, so that those who are most vulnerable could get served. But boy, we have a lot of work to do. A lot of work to do, not only in our social determinants, and that was not new news, but it certainly was amplified, but also the concepts of implicit bias and racism that again were laid bare right in front of us for all of us to see. And shame on us if we don't bring those lessons forward and work on equity every single day.
Linda, I know you've done some research in this space that the commissioner is mentioning. Do you want to comment on that?
Sure. Thank you, Mary. Actually, one of our faculty researchers, Dr. Charlotte Thomas Hawkins, took the lead on this study. This was her passion and her baby, so to speak. And she asked herself the question at the height of the pandemic, is this not a dual pandemic? Are we not experiencing a pandemic not only of COVID, but of racism and the negative effects of that? And aren't nurses of color experiencing that double whammy of COVID worry combined with workplace racism? And so she surveyed almost 800 New Jersey nurses, about 60% of which were white and about 40% were nurses of color. And she looked at COVID worry, emotional distress, incidences of microaggression and racism in the workplace, which was New Jersey hospitals. And what she found was that nurses of color experienced significantly more incidences of microaggression, workplace racism, and that those things, and COVID worry that they and or a family member or a loved one would be diagnosed and would suffer from COVID. And she found that those combination of factors was indeed a double whammy on nurses of color, and particularly of Black nurses, and that they had significantly higher levels of emotional distress compared to their white counterparts, and were significantly more likely to be thinking about leaving their job than their white counterparts. And that is something that we just cannot afford. We cannot afford to lose the diversity that we currently have in the nursing workforce, and in fact, have to work harder to increase that diversity. So I totally agree with the commissioner. Shame on us if we don't take this to heart. Shame on us if we don't begin to develop and implement strategies to reduce workplace racism among our nurses of color.
Now, Carl, you have been in the field throughout all of this, and you just heard what both the commissioner and the dean have said from their perspectives. How do you see it playing out?
Sure. As I listen to these stories, and I'm thinking about when we went through the epidemic the first time, one equity issue that emerged quite regularly in our population here at University Hospital. We have a lot of single parents who are raising kids, and when the schools closed, they had no one to take care of their kids, okay? And they had to work. And so as a healthcare organization, we needed to listen to that. That, you know, we needed to support the frontline workers. They couldn't afford to have a babysitter, or maybe there were people in the family that were sick as well, but they did need to work. So we here, altered their work schedule to make it, beneficial for them to meet their family obligations, as well as to come to work and provide care to the patients here in the hospital. So that's one concrete example of how these issues had emerged during the epidemic. And as a healthcare system or healthcare organization, we need to be flexible and think about the worker and support them in a variety of ways so that they continue to meet their needs in the community as well as here in the hospital.
Thank you all for those really thoughtful comments. It is quite the challenge for our future. Sort of along those lines, have these dynamics begun to transform the way that you're doing your nursing leadership, or nursing leadership more broadly, or the practice and education strategies that you see within the nursing field? And I'll start with you again, Commissioner.
Thanks, Mary. Well, I'm in a little bit of a different role, which you know very well, but I have a lot of thoughts about going forward with nursing. And I like to summarize what we're going through right now in nursing in 3 ways: burnout, age out, and forced out. So let's just talk about aged out. Nurses that were on the front lines during this pandemic at the worst of the worst, I'll say March, April, and May of 2020, that were close to retiring, they're leaving. That's the Great Resignation, right? They're close to retiring. Maybe they were said, I'm going to be here 3 more years. They're leaving. The PTSD is palpable in the individuals that I talked to. It was a very bad experience for them. And anything you read about nurses that work through that time, the compassion we have to have for what they went through. My worst night, Saturday night in an ICU in an inner city, does not compare at all to what our nurses went through. So they're aging out. And then there's some that are just outright burned out. They worked 24/7 during those 3 months and continued, but those 3 months were the worst. And they're leaving the profession. And they're the individuals that we really have to hold on to. They need to know how valuable they were. They need to know that the work that they did saved lives, even though what's in their mind are the mortalities. They need to know for every mortality they had, they saved many, many more lives. They need to know, and I say this all the time when I speak to groups, I tell them, you need to know that there were a lot of people sitting on the sidelines, but you were not sitting on the sidelines. There are a lot of people living through this history, and then there are those that were making history. And nurses on the front lines were making history. So their grandchildren will read about them in the books written about this pandemic. We need to hold on to the ones that are burned out. We need to help them. We need to support them. We need to bring them back to the profession that they have served so well. And then lastly, we have forced out. And that's where that whole concept of traveling nurses and agency nurses are really taking the place of nurses that want to commit to an organization. And that's where our mission comes in. If you're going to do piecework, hop from one organization to the next, you will serve your clients. There's no getting away from it. But you're compromising so much of that mission that an organization, a community health agency, a hospice brings together as a group with that teamwork to accomplish even greater things. But nurses are being forced out because of the money that is going to traveling nurses. And I'm not negative at all. Nurses should make as much money as they can possibly make for the work that they do. So that's not the point. The point is, how do we innovate to be able to accomplish both of the goals that nurses need to stay on the job, so that nurses are not forced out, that our organizations have the right financial foundation to give nurses what they need, what they deserve, and what they need to stay with an organization and help us fulfill our broad mission of making New Jersey a healthier place to live.
Carl, I know you are working on some of these initiatives at the hospital. Can you share a little bit about that?
So some of the things that we are taking a look at are more flexible work schedules for staff. That is something that can help retain and attract staff. We also have to look at the work environment. Right? That is a big factor of why people leave. And so here at UH, we have a program called UH Cares, which is a peer support program, which was initiated by one of your DNP students, Linda, and has taken that work and has brought that here to University Hospital. And it's a wonderful, wonderful program of peer support for people who need emotional well-being support, need help with coping mechanisms. And it's interesting, in the calendar year, we had 351 encounters with the peer support program. Think about that. That's about one person a day that is requiring some type of peer support or debriefing. So we are looking closely at the work environment to make it a healthy work environment that will attract and retain people. During nursing week, we are opening a wellness room, right? We're behind the 8 ball on that. Others have done that, but we are creating a beautiful space for the staff to emotionally debrief. It's going to be a relaxation room. We hope in the future to have programs like yoga and massage and wellness activities. And so you got to look at the environment. That's going to help retain and attract nurses as well.
And Linda, what about the new nurses and those who are in school now? How is this, how can we look there?
Yes, absolutely. Students and our faculty were not immune to the emotional distress and burnout that was going on and still is post-pandemic. And in fact, I need to give a shout out to Dr. Sue Salmon, who was instrumental in implementing Schwartz rounds across the state of New Jersey, nurse to nurse hotline across the state, and stress first aid across the state. And we have implemented those things into our curricula at both the undergraduate and the graduate levels. But let me just tell you a little bit about what our students were experiencing. Our undergraduate students at the time, many of them were working as care techs or nursing assistants or whatever. And so they too were on the front lines during the COVID pandemic. Our graduate students are already practicing RNs, whether they're in the Doctor of Nursing Practice program or the PhD. And so they too were on the front lines, as were most of our faculty who also practice as well. There were instances at both the undergraduate classes and in our graduate classes where one of the students would suddenly and spontaneously start to cry. And within minutes, the entire classroom was crying. So we knew that we had to implement Schwartz rounds, mental health, first aid, stress first aid, and these other strategies to help prevent burnout. And hopefully these will be skills that the graduates will take with them when they join the workforce. In fact, we are now requiring of all of our new admitted students that they be certified in mental health first aid. Because even when all of the effects of this pandemic are over, nurses face tragedies every day. And those are skills and those are resources that nurses will always need.
Linda, can you explain what those Schwartz rounds are for those of us that are less familiar?
Yes, it's where folks, in this case nurses, get together and they talk about what they have experienced with each other. And it's usually led by a psychotherapist or someone with that skill set. That just helps people verbalize, but also helps them perhaps try to make sense out of what they've experienced.
Thank you. That's helpful. One of the things that I want to sort of teeing off what you just said, Linda, about peer support and being more resilient as an individual, we can do this as a community as well. And I think that, I've observed women helping other women and nurses supporting other nurses and men supporting other men throughout this, crisis. And how can we do more of that sort of collective supporting one another as a community? And the broader community, how can they help nurses? Because they are such a critical and essential workforce. How can we help them? And I'm going to give you a break, Commissioner, and let Carl answer this one first.
So I'm going to take my cue from Linda's comment on one of the things that was critically supportive during the epidemics that we had was the academic practice partnerships that we have with Rutgers University. When we said we needed support, the students were right there. And they came in and supported those nurses in a variety of different ways. The nurses were looking for them to come in, and it just wasn't the nursing students, the medical students as well. We had created a title called Crisis Relief Workers in our organization. So that's a flexible title so that we could take any type of clinic. We have a clinical title and a non-clinical title. So any clinical person can come in and support our nurses during crisis staffing, when we had, people out sick and nurses had to take more patients than they traditionally would take care of. These crisis relief workers were there to support them in any way that they can. We had senior nursing students who were very experienced in caring for patients, and whether they could do assessments or put in IVs or whatever it is, they supported the nurses in any way that they can. I have to tell you, when I walked the facility and saw all of the students, both medical and nursing students, side by side, nurses in the rooms taking care of those patients. It was a beautiful thing to see. And so I think the academic practice partnerships are wonderful ways in which we can continue. The community at large can continue to support the nurses in the facility. They have to do the hard work on a day-to-day basis.
Linda, do you want to add to that?
Yes, and thank you, Carl. We were glad to be of help, and the students absolutely loved it. So thank you for the opportunity. I would just say that I would first acknowledge that at the height of the pandemic, the public were very supportive of nurses. But as as things sort of settled down and move towards a more normal, I think that I would just like to remind the public that nurses still need support. Like I said before, nurses face tragedies every day. It's not the easiest of jobs or professions to have with respect to protecting your own emotional well-being. And also to remind the public that those nurses that served so loyally during the height of the pandemic, they need time and space to heal. So let's be patient and let's continue to give them our support.
And it's a good time to remember that with Nurses Week starting next week. Hopefully there will be a good public effort on that front. Commissioner, do you have anything to add to this discussion?
I think we need to reflect on the lessons learned. And the one thing we have learned is that I do believe the public has a new appreciation for the profession of nursing. And I think we should not lose this opportunity to continue that momentum, to make sure that our public relations campaigns are really focused on what the individual nurses did for each and every patient that they took care of, but also what they did collectively to support a community. So, here at the department, we talk a lot about what are the messages that we want to bring forward to whatever we call this new normal. And one of the things is the role of nursing going forward, the role of advanced practice nurses in maintaining the health of their communities. Everybody did more, I guess we should say more with a lot less, but what happened is every nurse worked to the top of their license. And I think we need to look at that really critically and say, what was the best of what happened? Instead of focusing on the fact that it was just a terrible time, and boy, it was, we can't ignore that. But boy, did nurses shine. Did they really show who they were? And I think we've heard in lots of different venues, when someone shows you who they are, believe them. So believe that nurses definitely are the foundation of fulfilling our mission for helping people live long, healthy lives. It's nurses, it's the 150,000 registered nurses and many, many more practical nurses and supports that are doing that. And I think we better not forget that, and we better carry that message and remind people every single day that nurses brought the science to the bedside and they saved lives. And shame on us, again, if we don't continue that message. I don't care what group I talk to, I always make sure I talk about nurses and what they've done during this pandemic. And I know Carl would do that, and I know Linda would do that, and I think every single nurse should not pass up that opportunity to pat themselves on the back and say, do you know what I did over the last 2 years? I saved lives.
You're turning the corner now to how do we think about the future and, approaching either policies or practices or our culture in a different way. And whether that's in the workforce dynamics that Carl was mentioning, or in practice standards that you're reflecting, Commissioner. But, that's a question I'll pose to all of you, and I'll start with Carl in terms of, based on all the collective learning that we're still probably processing through, because we're still sort of in this and working through it. But what are some of those things that come top to mind about how can we take that collective learning and how can we improve where we are moving forward?
And thank you for Commissioner about mentioning the top of license issue, because that's a very important issue, not only here in New Jersey, but nationwide. And so the pandemic actually showed that we need to continue to push for top of license legislation and policy to make sure that all healthcare professionals are working at the top of the license, because it's essential if we're going to continue to evolve as a healthcare organization. So that's number one. The other thing I think we need to do is continue to help nurses, particularly nurses that have specialized over time, to continue to develop their foundational skills in nursing. Let me give you an example. When we closed our operating room, right, we had lots of OR nurses who forgot how to listen to lungs or listen to hearts, because they now specialized, and now they were taking care of critically ill patients, and they had to understand what oxygen was and all those kind of things. And so just in a way that we do like emergency management drills in our hospital, we probably need to do crisis foundational skills assessments of nurses to keep them sharp. And I mean, they stepped up to the plate. One day, again, they were doing OR work, and the next day they were monitoring and evaluating critically ill COVID patients. And so I think from a practice perspective, we need to continue to make sure that nurses have all the requisite skill to be prepared for a crisis and an emergency. And I hope that Dr. Flynn will talk about this. We need to emphasize public health nursing. I think it's critically important. And so the way that we train our nurses mostly to work in acute care setting, but working in a community. And and I want to thank the Commissioner, because there were people that came to our socially disadvantaged community and literally knocked on doors, to teach people and encourage people to get the vaccine. I mean, that's public health at its best. And I remember when I was in nursing school hearing about Lillian Wald, who climbed, over roofs to get to people's homes and care for them. And so I think we need to start thinking about public health nursing as a very, very important specialty, because this is not the last epidemic that we're going to go through.
Well, Carl, you're talking to an old public health nurse, so ditto. I totally agree. And in fact, that is the direction where nursing education is going. For our undergraduate curriculum, it is now basically focused a third on community, a third in acute care, and a third more on like population health, looking at aggregates at risk. So there's a very strong public health trend these days in nursing education, and it is indeed required by nursing education's accrediting bodies. I would just add to all of this. Well, first of all, let me say that I agree with the Commissioner and Carl that advanced practice nurses need to be allowed to practice to their full scope of knowledge and skills. They are far too knowledgeable, skillful, and have an ability to deliver primary and specialized care that our communities desperately need. And it is just plain silly to put a limitation on how they're able to use that knowledge and skills. So definitely support that. And the last thing I wanted to say is I just don't want us to forget the study that Dr. Thomas Hawkins did, I consider that to be it will be a seminal study. It will be one of the most important studies that I think nursing has produced in some time. We need to be very cognizant of the fact that our nurses of color are perceiving racism, microaggressions, they're experiencing microaggressions, and their emotional wellness and their ability to stay in their jobs are at risk. And we have got to do something. We have got to stop putting our heads in the sand over this very important issue.
We have a question from one of our listeners about how the crisis has affected the hands-on learning in hospitals, both for students via their clinical experience and for new graduates in terms of orientation. I'm wondering, Linda, if you want to answer that.
Yeah, actually, our students were out of the hospital for a relatively short time. The height, again, was like March and April. And by the end of May, most of them were back in clinical rotations. And so while it had an effect, we hope that we minimized that effect. And at the same time, they learned new skills. They learned skills in contact tracing. They learn skills and testing and that sort of thing, and in reaching out to the community in a more preventative way.
Thank you. And Commissioner, I'm going to turn this question to you, but there was a question in the Q&A that came that's related to this and for you in terms of along the lines of what have we learned. Is there a formal process that the department is going through, or an after action report similar to what we've done in other situations? It's a emergency response activity, and just how do you think some of the lessons learned will be reflected in that, in terms of how to work with our post-acute facilities or our home agencies, communication strategies that we've learned, working with community healthcare professionals as well as in our acute care hospitals, and developing or even holding on to some of those lines of communications that have been enhanced throughout this response between government and private healthcare entities. So there was a lot in there, and I'm going to let you run with it.
Thank you so much, Mary. There was a lot in there. So we certainly are using all of the concepts of an after action report that you would do for any emergency preparedness and applying it to the pandemic. Remember, most of the emergencies that we've had within the state have been environmental. They've been, the superstorm. And we learned a lot about how to organize the after action. But when you lay on top of it a once in a century pandemic, we can't forget that a lot of our learning, and we're still learning, is iterative. Remember, in most crises, there's a beginning and an end. Boy, did we pray for an end. Did we pray for an end every day?
Still praying.
It keeps going. This is a coronavirus that doesn't act like any other coronavirus we've ever dealt with, or any other epidemic that we've dealt with. So as we go on, we keep rolling inventory of what is this new normal going to look like. And the first thing I really want to emphasize is what we have learned about the value of diversity. We are one of the most diverse, I think, the most diverse state in the nation. We are the most densely populated state in the nation. We have over 1,200 individuals per square mile. The next state is like Rhode Island, with 1,000. Can't compare Rhode Island with New Jersey. But what that call does is to really look at the cultural barriers to taking care of people. And when we look at a nursing workforce, Linda is so right. We need a diverse nursing workforce that understands culturally the individuals that we're taking care of. And then we also need a public health infrastructure that can respond in the community to the diverse needs of their constituents. So first and foremost, working through that diversity net and saying more, we need more. How do we attract individuals into public health, into nursing that have the diversity that we need to take care of people more appropriately. The second thing is, what lessons do we bring forward? I can't de-emphasize, or I can't emphasize, I don't want to de-emphasize the importance of data. And developing a nerve center and a centralized data analytics and reporting section here at the department is underway. That's probably one of our biggest lessons, because we need real-time data coming from so many different outlets that is looked at every day, digested and acted on. And we didn't have that in the beginning. We did not have a good reporting structure. So that's kind of an example of some of the after actions that we've already been working on. And then being ready for crises. I think Carl talked about that. All the emergency preparedness that we've done, all of the tabletop exercises really did not prepare us for a pandemic, prepared us for a crisis that had a beginning and an end. And we're in a pandemic that's ongoing. So how do we make sure that our crisis management and our emergency preparedness keeps us able to pivot in a 24-hour period? Because it's going to happen again in different ways. And we need to be able to have that resiliency to bring up mega sites, to vaccinate deep into communities, or whatever we're called to do. We need to be able and ready to do that in a 24-hour time frame. And that's also like one of our after actions that we're working on right now. So I just gave you some examples. But I have to say, from a public health perspective, the diversity of our workforce, to be able to take appropriate care of the diversity of our state, which is something we're proud of, is something we have to work on.
Carl, Linda, do either of you want to comment or reflect on that? Because I'm sure you also have lessons learned, and whether or not you're going through a formal after action process or not, I'm sure you're working on those things.
Yeah, I'll go ahead and start. Certainly we're looking, the university is looking at the way people work, especially our staff, and are there ways that we can be more flexible and more understanding and helpful for those who have, small children or children after school or whatever. So the whole back to work or the future of work issue is one that the university is looking at, and all of the schools are exploring. And like I said, integrating more emotional support and mental health first aid into all of our curricula, and teaching nurses not only the skills and the science and the knowledge of nursing itself, but how to care for themselves emotionally.
And as the commissioner said, the process is iterative. And fortunately or unfortunately, we've had 2 go-arounds at this, and so we've learned how to be nimble. And when it's time to open up a new unit or get a vaccine clinic up and running, or receive the military to come help you, we got this down packed. We know how to do it now. And so, but it is a continuing looking at our processes and fine tuning, but certainly, we're always evaluating, could we do it better? Could we do it much more efficient? So we continue to improve over time.
We have another question from a listener, and this question is there a role for nurses in improving public health policy and planning partnerships, in particular within our underserved populations? So I think you probably could each speak to this, and I'll let you, the commissioner's smiling at me, so I'll let you go first, Commissioner.
Well, I've got to give a pitch for public health. I mean, everybody said, oh, she's a hospital person. How could she possibly know about public health? Nursing care and nursing education spans the continuum. And I say repeatedly, we're the only profession that actually touches every part of the continuum from birth to death, or I should say preconception to death. And also we touch all of that in our education. So of course I did community health nursing. I did community health nursing on the streets in Newark, New Jersey, when I went to Rutgers College of Nursing. That's what we did. And it was a distinction. It was a clear distinction that there's acute care, and everybody talks about acute care, but it starts on the streets. It starts in the homes. So the most exciting thing about public health nursing, and there's a role, we have 100 public health offices in our municipalities. We have, every county has a health office. And one of our after actions is to make sure the infrastructure is built up and continues to be built up. It was decimated over years nationally and in New Jersey. And the role of nurses in public health in those centers is needed, and we need to continue that. So yeah, that's the partnership. It's in the community, and we've relied on the nurses in the community. We've built up and funded more positions at our local health offices. So the partnerships for nurses, I think the world is open to those that are interested.
And in addition to the public health arena nursing, I want to add the school nurses. We need more school nurses, and we need to, that is a key place where we can be effective in breaking down the, disparate treatments in care and inequities in care, So I want to give a shout out to the school nurses who actually do a phenomenal job, but every school needs 3 or 4 school nurses, not in just in elementary school, middle school, high school. They are a phenomenal group. And I also do want to give a shout out to what Dr. Judy said about nurses working in data analytics. I think we need more of that. Nurses who understand big data and can look at it from a public health eye. I think that's critically important.
Yeah. Let me just add that can nurses or should nurses influence policy? Nurses have been influencing policy since Florence Nightingale, and she certainly saw that as not only the role, but the responsibility of nurses. And she was the one who actually started and implemented the visiting nurse service in London. What we know is the very first one in terms of being organized that way. So yes, and Carl, I totally agree with your comment about data and big data, and that's another way that nurses can influence policy. When I teach my PhD students, or I talk to my PhD students, and they tell me about their research question, and my question back to them is, so what? So what? So what are you going to do if your findings are what you think they're going to be? How are you going to leverage them to influence policy? Because when you get down to it, that's what nursing science, that's what nursing research is all about. It's not being published in some prestigious journal, although that certainly helps. But it's leveraging that science in a way, that evidence in a way that makes a difference. And that would be through policy.
And I think I'm going to give a shot at answering that as I move to closing, because we're at time, and just say that I think we've demonstrated with this panel how powerful the voice of a nurse can be. And so encouraging nurses to be part of this public discussion and have their voices heard is so incredibly important for our communities and our health. And so with closing, I'm going to quote Maya Angelou, who said, "I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel." And at the end of this discussion, I am feeling incredibly grateful and full of pride for our New Jersey nurses. So thank you for Carl, Commissioner, and Linda for joining us here today. I greatly appreciate it. And thank you to all of our New Jersey nurses and all of our listeners for participating in this conversation. And we wish you a very joyful Nurses Week next week.
Thank you.
Thank you.
Thank you.
Bye.
Bye.